Good evening. My name is Dr. Late Night. Welcome to your 10-minute cranial nerve exam. We're going to get into things very quickly now because we are short on time today. So I'm just going to check your heart. Might be just a little bit cold. Go ahead and breathe in for me. Good. Breathe out. Breathe in. And breathe out. Good. One more time. Breathe in. And breathe out. Very good. Your heart sounds just fine. I'm going to go from the top of your head and work my way down, okay? So I'm just looking through your hair. Good. I don't see any issues with dandruff or any other problems with your scalp. Good, and just looking at your ears here. Okay, good. I'm just taking a general look at your face to see that it is symmetrical. And I don't see any obvious abnormalities. Okay, can you go ahead and smile for me? And with your teeth. Okay, good. And frown. And puff out your cheeks. Keep them puffed. Okay, good. Now stick out your tongue and move it side to side. Okay, very good. Now just stick your tongue in your cheek for me. I'm going to press on that. And the other side. Okay, perfect. Now, if you will just close your eyes for a moment for me, okay? Close your eyes. And I just want you to tell me when you feel me touch you, okay? Good. 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 Very good. Okay. Perfect. You can open your eyes up again. Now I'm going to test your vision, okay? So first, I'm going to take a quick look at you, and I have this tool here. I'm just going to measure the distance between your eyes, just making your pupils at center line there, so if you'll just stay still for me, look straight forward at my nose. Okay. Very good. Marking down the measurement. Alright. Now, I just want you to look straight at my nose again, and I'm just going to be flashing up numbers, and I want you to tell me what the numbers add up to, okay? So, looking at my nose. Good. Very good. Okay. Good. 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 Okay, very good. Now keep looking at my nose, and I just want you to tell me when my fingers come in your peripheral vision, okay? Good. 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 Very good. Okay, perfect. Now can you go ahead and look at this hand for me? Okay, good. And now this hand. Okay, now look at my finger right here and follow it. Good job. Following my finger wherever it goes. Follow it. Does that strain your eyes at all? Any issues with that? Okay, very good. You can relax your eyes again. And I'm just going to shine a light in them very quickly, checking your pupils and just taking a closer look. So look straight at my nose for me. Okay. Good. I'm just going to put my hand right here between your eyes. Okay, wonderful. Now just follow this light for me as you did with my finger before. Checking checking how your eyes track, as well as your pupillary reaction. Alright. Perfect. Now just a couple more quick eye exams. I have a ruler here. Can you tell me what animal this is? Good, it's a cat. And what color? It's a black cat. Alright, so what I'm going to do is just hold this up to your face, okay? I'm going to be taking this wooden rod and I'm going to be moving to two different points on the ruler, and I want you to tell me if the first point or the second point is closer to you, okay? First or the second? Good. The first or the second? Good job. The first or the second? Good. One more time. The first or the second? Okay, I lied. One more time after that. The first or the second? Very good. Can you tell me what this is, please? Good, it's a hand. Okay, I want you to close your eyes, and I just want you to tell me when you feel it touch you, okay? Close your eyes. Good. 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 Now open your eyes. I'm going to touch you on the other side of your face with it, and I want you to tell me if it feels the same on both sides, okay? Both sides, okay? Your forehead. Good. And your cheeks. Very good. And your chin. Okay, wonderful. Can you please, final visual test for you. Just look at this. Can you tell me what this color is? Okay, good. And what's this color right here? Can you tell me what all of these colors together represent to you? Got a rainbow. Okay, and what kind of animal would you say this is? Okay, very good. Now I'm going to test your hearing, okay? So go ahead and close your eyes. Good, and I'm just going to whisper something in either of your ears, and I want you to repeat back to me what I whisper, okay? 23. Good. 5,700. Very good. One more time on either side. Rubber baby buggy bumpers. Good. Sally sold seashells by the seashore. Okay, wonderful. Now keeping your eyes closed, I want you to tell me how many times I snap, okay? Go. That was 17, very good. Now I'm going to do that by each of your ears individually, and I want you to tell me how many times, okay? Starting with the first ear, go. 9 times, very good, very good. Now the other ear. Wonderful, wonderful, okay. Now I'm going to make 2 sounds by one of your ears, and I want you to tell me if the first or the second sound is closer to you, alright? The first, very good. The second, very good. The first. And the second, wonderful. Alright. Now, I want you to go ahead open your eyes and take a deep inhale from me. What does that smell like to you? Good. It smells like strawberries. Very good. Now, do you have any issues with your sense of taste? Can you taste sweet, salty, bitter, umami things, spicy things? Very good. And are you allergic to any foods? Okay, perfect. Now, I believe we are done with our cranial nerve exam today. I haven't found any issues with you, but as you know, it's very important to come in to see me regularly so that I can check on things, make sure that you're still healthy and happy, just everything's running all right. Okay? All right, thank you so much for coming into the clinic tonight, and I hope to see you again soon. Goodbye. Good evening. Welcome to the clinic. What are you here for tonight? You say you've been having some issues with your eyes. I see. Well, my name is Dr. Late Night, and I will examine you over tonight very thoroughly to make sure that we identify whatever is going wrong here, okay? Most likely you will end up with some lenses, but I'm going to be screening you for a variety of problems you may have, okay? Perfect. So starting out, I'm just going to take a quick look over you. And I want you to let me know if you experience any discomfort at all throughout this exam. You shouldn't at all, but just let me know, okay? So I'm just taking a look at your eyes here. Just relax for me. Okay. I'm going to get my light. Might be a little bit bright, but it won't hurt you. I'm going to lift up your eyelid here, and I want you to look up for me. Good, and look down. Okay, look to one side. Very good, and then to the other side here. Okay, and then blink a few times. And I'm going to do the same on your other eye, just lifting the lid up. Okay, look up for me. Good. Look down. Okay, to one side. Very good. And then to the other side for me. Alright, perfect. Now I just want you to look straight at my nose, okay? And I'm just going to observe your pupillary reaction. I'm also looking to see that your sclera are white. I don't see any burst blood vessels, anything to be concerned about. Okay. Very good. Now, have you ever had any issues with your vision in the past? Or is this a recent occurrence? Okay. And does anyone in your immediate family have problems with their vision? Your parents, grandparents, siblings? Okay. And any past of excessive dryness or overwatering of the eyes? Alright. Very good. Now I would like you to just focus both of your eyes on the tip of my finger, okay? and just follow it as it moves in and out and in and out. Okay, keep focusing on the tip of my finger, moving it around, and I'm just observing how your eyes track. Do you have any blurriness as I'm doing this? Okay. And my finger is clear in your vision? Good, okay. Out one more time. And in towards you. Very good. I hope you've had enough break from the light, because I'm going to conduct another eye exam. So I want you to just look straight at my nose, okay? And I'm just observing how your pupils react here as well. Okay. Closer here. Just focusing on my nose, if you can. Okay. Good. Just relaxing for me through this. Okay, perfect. Now, I would just like you to focus your eyes both on this light and follow it all around for me, just as you did with my finger. Again, I'm checking both your pupillary reaction and how your eyes track. Okay. Any problems following the light? Okay, very good. Perfect. Go ahead and blink a few times. Next, I have this vision chart here. So what I want you to do is just go ahead and cover one of your eyes. Okay? Go ahead and read that top line for me. Good. And the second line. Okay. Third line. Fourth line. Can you read this one? Okay. Here. And the bottom line. Can you read that? Very good. Go ahead and swap eyes for me. And read this top line here. Second line. Good. And the third. Okay. Fourth. Fifth. Wonderful. Sixth. And the smallest line here. Can you read that? Very good. We're going to do about the same thing, but I'm going to turn down the lights, alright? So just give me one moment. Okay, now I'm just going to ask you to do the same thing again, occluding the original eye. And see if you can read this top line here. Okay, and the second line. Very good. The third, fourth, fifth, sixth. Good. Any issues with that? Okay, good. Seventh and the eighth. Alright, and switching eyes. This one here. Good. The second line. The third line. Fourth. Fifth. Sixth. Seventh. And the eighth. Wonderful. Now, while we have this dim lighting here, I just want you to focus on the tip of this light wand and just follow it, okay? Good. Okay. Any issues with the dim lighting? Do you feel your eyes straining or any other issues? Any blurriness, dizziness? Okay. Good. Okay. Good. You can relax your eyes again. And I'm just going to turn the lights back up. Alright. I'm going to test your color vision now. Okay? So you can keep both eyes open. And I just want you to tell me, what color is this? Very good. Now I want you to occlude one of your eyes. Okay? And take a good look at this color. And switch eyes. I want you to tell me if it looks like the same shade of red on both sides. Okay? Very good. Go ahead and occlude one of your eyes again. Now tell me, what color is this? Good. Okay. What color is this? Very good. And that. Okay, go ahead and switch eyes. What color is this? Good. And this. Okay. And what is this color? Okay, very good. And I want you to go ahead and do the same thing for me that we did before, including your other eye, and just looking to see that this is the same color on both sides to you, okay? It's the same shade. Okay, very good. You have no problems with your color vision. I want you to go ahead and look at my nose again, okay? And I'm going to be flashing up some numbers on my fingers in your peripheral vision. And I just want you to add up the numbers that you see on my hands, okay? Good. Looking straight at my nose. Good. Very good. Okay. Wonderful. All right. Good. Okay. Wonderful. Very good. Now, keeping your gaze fixed on my nose still, I just want you to tell me which finger comes closer to you, okay? Good. Resetting. Okay. Very good. That's right. Okay. Good. And one more time. Okay, perfect. Now, I just want you to relax for me. You can just look forward, focus on my nose if that helps, or whatever you prefer. But I'm going to be taking some measurements of your eyes and your face, okay? Alright. Measuring your eye here, your pupil as well. Good, and then from the bridge, your nose here, the outside of your face. Okay, and the other side, I'm checking your eye, your pupil. Okay, the nose, the outside of the face. Good, and distance between the eyes. Okay, wonderful. Now, I'm going to measure from the outside of one eye, the outside of the other. That's right. Okay, just double checking my work here. Very symmetrical face. Okay, and some basic measurements of your forehead. Chin. Okay, your nose. These will be important as well for fitting you for lenses if we decide that that is the route that we need to go. Okay, wonderful. I have this little cotton wisp here, and I'm just going to very lightly tap you on your eye, and I'm just testing the reflex there. So the normal response would be to blink. So I just want you to look up for me, okay? And just a very gentle tap. Shouldn't be uncomfortable, just to trigger the response. Good. And the other side. Okay. We're doing it one more time on each side just to be sure. Okay. Very good. You can look down again. Now I want you to look straight at my nose again, okay? I'm just going to be bringing my fingers into your peripheral vision. I want you to tell me when you can see them, okay? Looking at my nose. Good. Now using my lights again, I want you to focus on this one, okay? Now switch and look at the other one. Now switch back and over to this one. I just want you to keep looking back and forth as they move, switching every second or so. Okay, now fixate on one light. Stay there. I'm just going to take one last look at you here, pulling up your eyelid just gently, taking a look at your lid and your tear duct, all around, making sure I didn't miss anything. I don't believe I did though. Alright. And on your other side here, just taking a look. You've been a very good patient this evening. Okay, very good. And you can just relax. I'm going to take one last feel around to make sure there's no inflammation, lumps, bumps, or dryness around your eyes. This side. Okay. Just double checking here. Wonderful. Okay. I don't believe that we've missed anything tonight. Seems that you are going to have to get some corrective lenses, but there are no other major problems with your eyes. This is very normal to need glasses. More and more people every year are needing them for even just reading or long distance. Right, so we will have to schedule you a lens fitting and also to figure out your exact prescription, as today was just an exam to determine the underlying issues. Alright, well, thank you for being such a wonderful patient, and I will see you again soon. Have a lovely night. Good night. Hi there, my name is Dr. Late Night. Can you look at this finger for me, please? Good, and at this finger, and go back to the first finger, and back to this one. Okay, perfect. I would like you to please read this line for me, and this line, and then this one. Okay, wonderful. I'm going to give you 3 words to remember, and I'll quiz you on them later. Dog, circle, and bicycle. Can you repeat those back for me, please? Wonderful. Look straight at my nose. I'm going to check your pupils. Okay, good. Good. And just follow this light for me for a moment. Alright, perfect. And open your mouth wide and say ah. Stick your tongue out. Good. Now I'm going to test your hearing, so go ahead and close your eyes. Can you hear this? perfect. Can you hear this? Very good. Can you hear that? Good, and tell me when it stops. Okay, perfect. You hear that? And tell me when it stops. Good. I'm going to whisper something in each of your ears, and I want you to repeat it back to me, okay? 13. Good. 79. Perfect. You can open your eyes again. I'm going to check your heart now. Take a deep breath in for me. And out. And another one in. And out. Perfect. And can you please recite back to me the 3 words that I asked you to remember? Okay, perfect. Very good. There seems to be nothing wrong with you, but make sure you come back to the clinic regularly for your cranial nerve examinations, as they're very important, okay? Have a good night. Hi there. You're here for a cranial nerve exam today? Okay, wonderful. My name is Dr. Late Night, and I will be your doctor today. And we'll get started quickly because this can be a bit of a lengthy exam, okay? So just lay back, get comfortable, and I'll get started. Starting off, I'm quickly going to test your cognitive function, alright? So I'm just going to give you 3 words to remember, and then I will quiz you again on those words in just a few minutes, okay? So the words are Chevrolet, zebra, and honesty. Can you repeat those back? Very good. Try to keep them in the back of your mind, and I'll test you in a minute. So moving on, I'm going to ask you just a few questions to make sure you're alert, oriented, and have just basic common sense, basically. So if you will tell me where you are today, okay, and what is the date? Very good. And what are you here for this evening? Cranial nerve exam. Perfect. Can you tell me how apples and oranges are alike? Okay, good. I know it seems like a silly question, but we're just screening for any mental problems here, which I don't think you have. And just a basic math question for you. If you'll tell me the answer to 3 times 5. Okay, perfect. Now, this is a little bit of a difficult one for some. Can you spell world backwards for me? Okay, good. I know that's a little bit of a tricky one. It makes you think. And finally, if you will just repeat rubber baby buggy bumpers 3 times fast for me. Okay, perfect. Now, just going back to a moment ago, do you remember those words that I told you? Okay, perfect. Now we can begin with the rest of the exam. Now, do you have any specific concerns that you want me to address today? Okay, good. So I'm going to just take a quick look over you. Inspecting your head, your face, and palpating some. Is that okay? Okay, good. So, starting at the top of your head, I'm going to parse through your hair here, just checking for any excessive dandruff, any lumps, bumps. I don't see any abnormalities here. Okay. Okay, very good. Moving down, I'm going to just massage your temples. Do you have any pain as I do that? Any tenderness? Okay, wonderful. And palpating around auricles of your ears on either side and looking behind them. Okay. I'm also just looking over you to see how symmetrical your face is, and if you have any glaring problems with your skin. I'm not seeing anything jumping out to me here. Okay, I'm going to quickly press on your sinuses, just gently. Do you have any tenderness as I do that? Okay, very good. And now moving on to your jaw, I'm just going to massage there. Do you have any pain? Good, okay. And then just open and close your jaw for me. A few times, open and close, open and close. Good. Is that uncomfortable for you? Okay. You don't ever experience any clicking of your jaw or getting stuck ever? Wonderful, that's good to hear. Okay, now if you will just lift your head up a little bit, and I'm going to massage your thyroid gland. Make sure there are no problems there. Okay, good. And checking your lymph nodes. All the different lymph nodes. We have a lot of them. Do you have any soreness when pressing on them? Okay, good. You haven't been sick recently, have you? No. Okay. Perfect. Wonderful. Go ahead and put your head back down for me. And I'm going to just listen to your heart, okay? So relax, sit back. Take a deep breath in and out. Breathe in and out. Breathe in. Breathe out. Good. Breathe in. Breathe out. And breathe in. Breathe out. Wonderful. No problems with your heart at all. Next, I'm going to test the sensation in your face. So I just want you to tell me, can you feel when I touch here on your forehead? Good. And can you feel when I touch there? Wonderful. Does it feel about the same on both sides? Okay. We're going to do that again. Can you feel when I touch you there? Good. And on the other side. Wonderful. And then one more time here. And here. Can you feel both of those? They feel about the same? Okay, very good. Moving on, I'm going to test your facial sensation one more time, but this is your ability to feel a light touch. So I'm going to brush you with this cotton pad, and I want you to tell me again if you can feel it and if it feels the same on both sides, okay? Here and here. Good. Here and here. Wonderful. And here and here. Okay, perfect. Next, we're going to check your motor function and the mobility of the muscles in your face, okay? So if you will just follow me in doing some silly faces and some movements, alright? I want you to raise your eyebrows up and scrunch them. Good. Now smile big and frown. Okay? Now I want you to lift your head to the side and the other side. Look back and forward. Very good. And tipping your head to one side and to the other. Okay, perfect. Now if you will just stick your tongue out for me and move it side to side. Okay. And stick your tongue in the side of your cheek for me like this. And I'm just going to press against that. Okay, very good. Now if you will puff your cheeks out. Keep them puffed. I'm going to tap. Okay, very good. And finally, can you make a fishy face for me? Okay, perfect. Now we're going to do something that might seem a little bit strange, but I just want you to look straight at my nose, and I'm going to tap you on the forehead, and I just want you to try not to blink for me, okay? So staring straight at my nose, just tapping your forehead. Okay, very good. You can look away from my nose now. Moving on to your eyes, I'm going to first check your pupils. So look straight at my nose again. And I'm just going to check that they are reacting to light accommodation accordingly. One more time on either side. very good. Look away from my nose. Let your eyes focus for a moment. And now I want you to follow this light wherever it goes. Okay? Follow the light. Just checking your eye's ability to track smoothly as it comes in and out, all around. Okay. Good. Very good. Can blink a few times if you need to. Now, if you will just look straight at my nose again, I'm going to be wiggling either one or both of my fingers in your peripheral vision, and I just want you to tell me which side you see wiggle, okay? Looking straight at my nose. Good. Good. Okay. Good. Good. Okay, perfect. And now, continuing to look at my nose, I want you to tell me which finger is coming closer to you, okay? Okay, good. Resetting. Good. Resetting. Perfect. Good. Resetting. Okay. Very good. You can look away from my nose now, okay? Now, I have to ask, do you normally wear corrective lenses or contacts? Okay. Now, I'm just going to have you cover one of your eyes, alright? And I'm just going to have you read the lines as far down as you can, starting with line 1. Good. 2. 3. Okay. 4. Can you read 5? Good. And 6. Okay, wonderful. Now go ahead and cover your other eye and read line 1 for me. Line 2. 3. 4. 5. And 6. Very good. Finally, for your eyes, we're going to test your ability to see color, okay? So I have this light wand, and I just want you to cover up one eye again for me. And look at this red light. Now cover up your other eye. And I want you to tell me, does it look the same shade of red on either side? Go ahead and double check. Okay, wonderful. Okay, that completes the eye portion of the exam. Moving on to your nose and your sense of smell. When you go into a coffee shop, are you able to smell coffee? Okay, perfect. And I want you to just cover one nostril for me and breathe in and out. Good. And on the other side? Good. Any problems with that? Okay, perfect. And I'm going to take a quick look in your nose. So if you'll just tip your head back a little bit for me. And I'm going to shine a light, checking for any blockages, any abnormalities. And I don't see anything out of the ordinary. Okay? You can put your head back to the normal position. Now, moving on to your sense of taste. Do you have any issues with tasting things like salty, sweet, bitter, spicy, umami? Okay, perfect. Now, before I conduct the test, I have to ask, do you have any allergies? Okay, very good. I'm just going to ask you to close your eyes for a moment, open your mouth, and I'm going to sprinkle something on your tongue, okay? Go ahead and taste that and tell me what it tastes like to you. Very good. It's sugar. Okay, you can open your eyes again. And I'm going to just take a quick look in your mouth now, okay? So go ahead, open wide and say ah for me. Ah. going to depress your tongue there and take a look. Okay. Your uvula is midline and moves according to your vocalization. I don't see any cavities. Okay. Do you still have your tonsils? Ah, yes, I see. Okay. Wonderful. You can close your mouth now. The final portion of our exam will be testing your hearing and taking a look over your ears. So I know that I palpated them earlier, but I am just going to quickly shine this light on either side, just pulling your auricle out side so I can see. Okay. And pulling out on the other side, looking in your ears. Don't see anything abnormal there. Alright. Have you experienced any problems with your hearing in the past? Okay, very good. You don't find yourself asking your family to turn up the volume on the TV? Wonderful. Now for the rest of our hearing test, I'm going to have you go ahead and close your eyes. And first, I'm just going to whisper some words or phrases in either of your ears. And I just want you to tell me what I whisper, okay? Cranial nerve exam. Very good. And the other side. Thank you for watching. Good. And then just one more time on each side. 27. Very good. One more time. 42. Okay, very good. Now I'm going to be fluttering my fingers by either of your ears, and I want you to tell me if the first sound or the second sound is closer to your ear, okay? So let's do a practice round. First sound, very good. Okay, now we're doing the actual test. First, good. Second, good. First, good. First. Second. Second. Very good. My final test for your hearing will include striking a tuning fork, so if you do not like the sound of tuning forks, let me know now. Okay, wonderful. So I'm going to strike this tuning fork and bring it in closer towards your ear. I want you to tell me when you can hear the tuning fork. Then I'm going to stop it, and I want you to tell me when the sound stops, okay? So tell me when you can hear this. Okay. And tell me when it stops, okay? Very good. And on the other side, tell me when you can hear this. Okay. Tell me when it stops. Very good. And we're going to do that once more on either side, okay? Good. And tell me when it stops. Okay. Tell me when you can hear this. Good. Tell me when it stops. Perfect. Alright, you can open your eyes now. Give yourself a moment to adjust back to the world. If you need, you may lay on a couch in our waiting room, as many people feel in a daze or sleepy after their cranial nerve exam. I I haven't found any issues, any abnormalities, but as you know, it's important to come in for your routine checkup, so I will be seeing you very soon again. Thank you so much for visiting the clinic, and have a great night. Evening. My name is Dr. Late Night, and I will be performing your routine eye exam this evening. So, you know the drill, just follow my instructions and it should be easy peasy. Many people find it relaxing, in fact. So it will just begin by having you focus your eyes on my finger, following it in and out. Good. Continue following my finger with your eyes. Wonderful. Continue looking at it. I'm just going to try to distract you, but keep focusing on the finger. And this finger now. Okay, very good. Can you look at my nose now for me, please? Okay. We're going to check your peripheral vision, so focusing straight on my nose, I just want you to tell me what number you see on my hands. Good. Now add them. Good. Good. Perfect. Okay. Wonderful. Very good. I'm now going to check your pupillary reaction. So I just have this light here with a diagram on the side to determine what size your pupils are. So just look straight at my nose again, alright? I'm going to check each of your eyes. Very good. Do you have any problems with your vision typically? Okay. Any problems reading books? And what about like road signs when you're driving? Do you have any problems with that? Okay. Good. Now I'm just going to put my hand right between your eyes. Looking one more time for your reaction. Just softening your eyes, relaxing. Okay, good. I'm just going to hold your eye open very gently here and take a closer look. Looking at my diagram here to determine the size. Okay. Take a few blinks. And on the other side, opening up your eye, just taking a closer look. Okay, and determining your size here. Good. Alright, your pupillary reaction is completely normal and they react evenly according to light stimulus. I have this toy here, although we'll call it a tool in this case. I want you to just pick one of the balls on the ends, any ball on the ends, and focus on it. Tell me what color it is. Okay, now I want you to keep your eyes on the ball you've chosen as I move it around. Doing your best to keep your eyes focused on your target. Okay, is it difficult for you to focus at all? Do you experience any pain behind your eyes doing this? Or when you read? No? Okay, good. One more time. I'd like you to pick one of the balls on the interior here. So perhaps this one, this one, this one, just one of the balls inside, okay? Focus on it, hone in on it, and do your best to follow it now for me. Good. Now, any problems with that? Alright, perfect. Now, can you please tell me what color this is? Good. Now I want you to close one of your eyes, focusing on it, and now swap and close your other eye. Tell me, does it look about the same shade of yellow on both sides? Same brightness? If there is a discrepancy, can you describe to me, say if it's in the right eye, it's 100% yellow. Would it be about 80% yellow in the other eye? How big is the discrepancy? Alright, wonderful. Thank you. Go ahead and take a few blinks and readjust. I'm going to test your color vision one more time here. Can you please tell me what color this is? Good. It's a vibrant pink, neon pink. Now I'd like you to again close one of your eyes. Take in the color, the shade. Now switch to your other eye. And is it about the same on both sides? You can check again if you need to. Perfect. Alright. That clears things up on that front for me. Next, I am going to draw a shape in the air, and I want you to tell me what shape I draw with the tip of this chopstick, okay? Triangle, good. Again. Very good. A square. Again. Perfect, that was a circle. Now, this might be a little bit difficult, but I'm going to write a word on my hand, just a 4-letter word, nothing too difficult, and I want you to tell me what I write, okay? The word was fire, good. And I'm going to write one just midair, another word for you, okay? So just focus very carefully. Did you get that? Good. It was ASMR, which is, of course, autonomous sensory meridian response. Alright, perfect. Moving on now. I have this eye chart. We're just going to test your vision here, your reading capabilities, okay? So starting off on the letter side of it, I just want you, with both eyes open at first, to read this first line for me. Good. And the second line, the third, the fourth, the fifth, the sixth. Can you read that line? Good. The seventh and the 8th. Good. Now I want you to just cover up your right eye for me. Okay, so just your left eye is uncovered. Can you read this line backwards for me? Perfect. And this line backwards. Good. Let's jump down to this one. Can you read it backwards for me, please? Alright. And this little one at the bottom. Can you read it backwards? Very good. Now uncover your right eye and go ahead and cover your left. Now with the left eye only open, I would like for you to read this line forwards for me. Good. Can you read this line forwards? Alright. And moving down to this line, read it forwards for me. Wonderful. And down to the bottom. Can you read that for me, please? Beautiful. Now, with both eyes open again, this will be very brief, but can you just tell me which direction these E's are pointing? Starting with this one. Good. And the second one. Alright, and the third one. Very good. And just a little bit of a challenge. Can you tell me what direction this E is pointing? Okay, and the second one. And finally the third. Very, very good. Alright, take a few blinks, readjust for me. We are nearly finished with your eye exam. But next I have for you this light rod. Can you just focus on the tip of it for me? Both eyes, yes, both eyes. Tell me what color it is. Good. Now I just want you to follow the tip of it. Just relax your eyes. Allow your gaze to follow it. Any problems with that? Is it any more difficult for you to follow the light than it was for you to follow my finger? Alright. Just go from one side down to the other, up and down and up and center. Good. Now follow it as it goes away and back close. Keep your gaze on it and away. Okay, good. Any issues with that at all? Okay, wonderful, perfect. That concludes our eye exam for this evening. I haven't noticed any abnormalities or anything wrong with you, but as you know, it's very important to keep up with your routine exams. So I would encourage you to come in for a cranial nerve exam, hearing exam, or whatever else you may need. I'm always here, okay? Wonderful. Well, you have a great rest of your evening, and I hope you get a wonderful night's sleep tonight. Good night. Good evening. My name is Dr. Late Night. What brings you into the clinic today? Oh, I see. You're having some problems with anxiety and accelerated heart rate. Alright, well, I can certainly help you with that. I'm just going to conduct a series of tests and various things to take care of you, techniques that I'll teach you to help lower your heart rate, okay? back, relax, and let me do all the work. Alright, so I'm just going to get a baseline reading of your heart rate, okay? Yes, just lay back. It shouldn't be uncomfortable at all, maybe just a little bit cold. Okay. Here, take a deep breath in for me. And out. Good, breathe in. And out. One more time, breathe in. And out. Alright. Your resting heart rate is certainly higher than normal, so I'm going to begin by just gently massaging your temples. What I'm doing is just relax you, lower your blood pressure. Okay, I want you to take some deep belly breaths in, trying to fill up your stomach with air as much as possible, and then hold it for a few moments and breathe out. Good. Just parsing through your hair here, also giving you a little bit of an exam while I'm at it. Temples. Good, and around your jaw. Is this your first time at the clinic? Wow, it's very good. Very good to have you here. We'll make sure by the time this session is over, you will be relaxed and ready for rest or whatever else you may need to do. And just gently patting your face. Not only are we trying to reduce your heart rate here, but also just tuning you back into your body. Good. How does that feel? Okay, perfect. And just down your neck, your shoulders a little bit, giving you a massage. Deep breath in, hold it, and breathe out. Good job. Alright. I'm going to take another listen to your heart now, just to see where that has gotten. Good, okay, just relax again. Breathe in and out. Good, some progress there. Breathe in and breathe out. Good, one more time. Breathe in and breathe out. Wonderful job. Definitely lowered your beats per minute, but I have quite a few more tests and relaxing things for you. So, let's move on. Now I want you to just relax for me, okay? And I'm going to just wave this calming light over you. calming blue light. Calming blue light. Just relax your eyes, the muscles in your eyes. Just calming out any anxiety, allowing this beautiful light to consume you. Good. Good. I want you to take a deep breath in. Hold it. Breathe out. Good job. Breathe in. Hold it. And breathe out. Good. Breathe in. Hold it. And breathe out for me. Good. Relaxing. Relaxing. If you'd like, you can let me know what has been stressing you out recently. You don't have to, but I'm here if you'd like to talk. Oh yeah, I understand. Good. Wow. Thank you for sharing. I understand life throw all sorts of unexpected things at us sometimes. But it's important to take time to reconnect with the body. Alright. I have one more light I'm going to pull out, but I'm going to want you to follow with your eyes. I'll be moving it back and forth, and this gentle back and forth movement simulates the motion of your eyes during REM sleep. So the goal here is to sort of trick your brain to thinking that you are entering a deep, relaxed state. Although hopefully it's not a trick and you will be in a deep, relaxed state. Good. So I want you to just focus on this light. Focus on it. It goes back and forth. Back and forth. Following it with your eyes. Take a deep breath in. Hold it. Breathe out. Good job. Good. Breathe in again. Hold it. And breathe out. Good. You're doing wonderfully. There's no place else you need to be. Just right here. Resting. Relaxing with me. I notice your breathing. It's gotten slower. You're breathing more deeply than you were at the beginning of our session. That's very good. The breath and the heart rate are very much linked. Perhaps you could call them siblings. Good. Okay. Just relax your eyes, and I'm going to check your heart once more just to see where we're at. Okay. You know the drill. Breathe in for me. Hold it. Breathe out. Good. Breathe in. Hold it. Breathe out. Good. You're doing wonderfully. One more time. Breathe in. Hold it. And breathe out. Good, good. We are definitely getting there, but I would like to lower your heart rate just a bit more. So, next we're going to use these ice globes, which will be cooling on your face. Oftentimes, temperature can affect us greatly in our stress levels, reducing stress. So, putting this, it's going to be a little bit cool. Good. Gently rubbing these ice globes on your face. The cooling sensation should be relaxing and lower your heart rate. Taking some deep breaths in, full inhales and full exhales. Wonderful, you're doing perfect. Everything is just as it should be. You're safe. I want you to feel at home while you're here. You may sleep. If you wish, afterwards we'll set up a room for you to rest here. Rest here. Down your nose. Your cheeks. Good. Your forehead. Your jaw. Letting go. Relaxing your eyes. Your cheeks and your forehead. Just relaxing all the muscles. Wonderful. You're doing so well. Good. All right. Just giving the temples one last massage here. Good. just check your heart one more time here. Breathe in. And breathe out. Wonderful. Breathe in. Hold it. And breathe out. Good. One more time. Breathe in. Hold it. And breathe out. Wonderful. Alright. We are absolutely getting there. Seems like you are entering a relaxed state, lowered blood pressure. However, I want you to close your eyes for me, okay? And I'm just going to make some subtle sounds by your ears that are proven to reduce stress, calm, and clear the mind, okay? So just listen. While you're listening, I'm going to do some box breathing. So I want you to breathe in for a count of 4, hold for a count of 4, exhale for a count of 4, then hold that for a count of 4, okay? I'll guide you. Go ahead and breathe in. 1, 2, 3, 4. Hold. 2, 3, 4. Exhale. 2, 3, 4. And hold. 2, 3, and 4. Breathe in. 2, 3, 4. Hold. 2, 3, 4, and exhale. 2, 3, 4, and hold that. 2, 3, and 4. Breathe in. 2, 3, 4. Hold. 2, 3, 4, and exhale. 2, 3, 4, and hold. 2, 3, 4. Breathe in. 2, 3, 4. Hold. 2, 3, 4. Exhale. 2, 3, 4, and hold that. 2, 3, and 4. One more time. Breathe in. 2, 3, 4. Hold. 2, 3, 4. Exhale. 2, 3, 4, and hold that. 2, 3, and 4. Very good. At this point, you can open your eyes or keep them closed.